Drinking Ace of Spade out of plastic cup. I'm on the conference call while I'm sacking up. You see these thigh pads, nigga, clap it up. Clap it up. I'm on the way to the bank and I'm cracking up. That because we rich, 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 yeah, rich, yeah, rich, yeah.
Ratchet Wizdom, the podcast, back again on their ass. What's up? How y'all doing?
What's happening, bro?
We got a new location, y'all.
Oh, yeah, we coming up.
Yeah, moving on up to the east side, man.
Look at us.
That's
Still
a
on the
beautiful
east
thing.
side. Step above.
Right,
Yeah.
fact.
Still on the east side, though. We staying true.
Well, today, we got another special guest in the building. You know what I'm saying? It's going to be kind of hard for me to give her the proper introduction because I actually met her through a friend of mine who's a doctor who's also in the medical field, Dr. Ricks. Y'all shout out to Dr. Baku one time.
Cool.
He was, you know what I'm saying, generous enough to let us use one of his colleagues, co-workers, however that works. We have Dr. OConnor, neurosurgeon. Yeah.
Welcome, Doc.
Euro. I'm thinking about money. Did I say euro?
No, you said
No, you said neuro. You said neuro.
Would you like to give yourself an introduction, doctor?
Absolutely. Good evening, everyone. As Nao mentioned, I am Dr.
Nayo. That's your new name, bro. Nayo.
Dr. Smash, please.
It's okay. Everyone calls him Nao.
Nayo, Neo, Nayo.
That ain't about me right now. Anyway.
Apologies there.
Yeah.
Dr. Tia O'Connor, neurologist at Grady.
Shout out.
The Grady Memorial.
The Grady Memorial. Been there approximately 6 years now. So.
Oh, wow.
Yeah,
That's what's up. So what exactly does your day look like?
Wow. So I'm sure all of you all know Grady is a trauma center. So we're seeing a lot of patients that are coming in and out, especially with the way that people drive in Atlanta. You know, we're seeing a lot of trauma patients coming in. So my days are long. You know, I actually just got off work not too long ago. So days are definitely long, seeing a lot of different patients dealing with, you know, injuries, trauma to the head. Any type of neurological issues that are going on with them. Those are the types of patients that I'm seeing. So day to day, heavy rotation, a lot of folks coming in and out. Barely have time to step away and use the bathroom.
I'm sorry to cut you out. But, you know what I'm saying, I know you kind of up there in the food chain. So what do somebody got to do to come see you? How they make it to your office? Well, not your office, but to see you. You know what I'm saying? What type of head injuries? You know what I'm saying? Because let's just say I got shot on that headboard and I'm tearing her shit up.
Honestly, that's the perfect example. We do see a lot of patients that come in from sex injuries. I know that you all have probably seen the show. Sex sends you to the ER. So that is one of the examples that we do see.
How often you see that?
I would say at least 30% of our patients that
30%.
30%.
Wow. Are these? Would you say these are severe head injuries?
These are very severe head injuries.
Damn.
Yeah. I mean, y'all. It comes across as comical and funny, but you know. Honestly, there really are some severe patients that come in. A lot of trauma where the concussions, you know, obviously concussions are a big one. Bruises to the brain, you know, damage to the skull.
From the headboard?
Absolutely.
Any bleeding on the brain?
Yes, that is something that we do see come.
Wow.
That's some rough sex.
That's my first time hearing that. Damn. That's my first time. And this is what Dr. MH expert was talking about when she was saying, don't beat that pussy up. You don't want to.
Literally.
You don't want to go that far. You got to be in the ER.
So look,
go see
Shout out to Dr. MH.
So when these patients are coming in, is there any like sex education afterwards? You know what I'm saying? Because they
take it easy.
You know, quite frankly, I feel like people should have a great time and do what it is that they do. And I mean, the more often that they're having these sex injuries, the more often that they're coming in to see me, and my paycheck is going up. So, you know, quite frankly,
Okay.
keep knocking that box out the frame. You know what I'm saying? Keep knocking that box out the frame. But I mean, for me, you know, it generates income. So, you know, I let other people handle that. As far as the sex education and things like that.
Would you recommend referring out to any additional treatment, like counseling or something for like some post-traumatic stress?
Honestly, I mean, I feel like sex is a stress reliever. So, honestly, I'm not referring anybody out because, again, as I said, the more that these patients are coming back with these head traumas and issues, especially because of sex, like that's quite frankly
Easy money.
Easy money.
Easy
Because
money.
we, you know,
Keep knocking it out the frame.
knocking it out the frame. Come see
whoever
Dr.
else is
O'Connor.
out there knocking it out the frame.
Send them to Grady if you don't knock it out the frame. Send them to Grady.
That's definitely not the objective.
Hey,
We're not.
that's definitely some ratchet wisdom. You know what I'm saying?
For sure.
Let's switch gears, you know what I'm saying? I just had to get that out of the way. On a more serious note, you know what I'm saying? I don't know if you're familiar with Antonio Brown, but he's been in the
She was
headlines
serious,
a lot.
She was serious.
Oh, yeah. But you know.
She
you know
did
what I'm
say that happened for real.
Well, for me, let me be serious, because I was just playing. I ain't going
Wasn't
that
expecting
crazy.
that.
But it really could
He thought he
happen.
was gonna catch
That shit
you.
really
He thought he was
Yeah.
gonna, you know, have her tripped up because she a doctor or whatnot.
Nah.
But she had one for your ass.
She said I did.
I can't lie. She
No.
Don't play with Dr. O'Connor.
What you were talking? You was AB, right? You
Yeah,
talking
okay,
about
AB,
Antonio
you know what I'm
Brown.
saying? There's been speculations about him might have a CTE because of his behaviors or whatever. But youth football is real big, you know what I'm saying? So I was wondering do you think that kids playing youth football is catching the CTE early, or do you recommend for kids
That's
to
a good
play
question.
contact youth sports, you know what I'm saying?
Well, honestly, I'm gonna just go ahead and cut you off right there because honestly, forget the kids, quite frankly, because and I'm sorry, that might sound very, very harsh.
I was like,
F them kids. F them kids.
Look, y'all should have said Zakia.
Sorry for the mothers in the room. I do apologize in advance.
I mean, you didn't say fuck my kids, but you did say fuck those kids.
Yeah,
Oh,
I mean, I just sorry, it's a little bit of the personal coming out. I've had some really bad experiences
You had a long
in
day.
running
You just came off work too.
with the youth recently. So it's been I'm gonna just pull this up so I don't have to lean so much.
Okay. Get
So I do, thank you. Lord, it's been a long day. But, you know, I the run-in with the children that I've had, it's been very interesting, you know. So it's a great question that you've asked in regards to CTE and how I feel about that with the youth. I feel like it might knock some sense into them, quite frankly, you know. And I know that's again harsh. I do apologize, but I'm being fully transparent.
Okay.
What is CTE? I know.
This is called Ratchet Wizdom, right?
This
Keep
Ratchet
playing these
Wizdom.
contact sports.
But I know a lot of people out there they're not familiar with.
Because y'all out here bogus.
Yeah.
So what is
Y'all
CTE?
got Dr. O
This
fucked
is
up.
hilarious.
Hold on, y'all. Hold on.
Sorry, y'all.
So
I go.
So CTE is essentially it's a degenerative brain disorder, and it's not diagnosed until after a patient is deceased, and that's the only time that we can really, you know, get in and really figure out what's going on. So some of the symptoms.
Wait. So they don't be knowing when they're alive if they got it?
That's correct.
No, they test their brain like after, like post.
Yeah.
So all of it is speculation. If we see somebody who just get tackled, get hit real hard on the field, and they have a whole bunch of concussion symptoms, and they come in, they have it over a period of time, we're just assuming that they could possibly have CTE. You can't diagnose them right there.
Correct. Yeah,
Okay.
absolutely. And most times you're going to see that in high contact sports, such as football, and any other high impact sport. You're going to see that quite often in the patients after they are.
Why is that though? Why they can't see it while they're alive? Oh, you can't.
Well,
Because you can't
go
get
the
into someone's brain.
Yeah.
and do all the testing.
the
correct.
wrong thing to a brain. Fucks your whole life
whole
up,
life
your whole
up.
body.
Might be paralyzed.
Brain dead. You just dead. Yeah. So, would you say have you seen CTE in like car accidents? I know you did say you work at Grady. I know they can't test until after they die, but I guess have you seen studies where there's been a lot of CTE in personal injury cases like that, like car
Absolutely.
accidents?
Yeah. I would say about percentage wise for CTE from like personal injury, I would say it's about 45% that you'll see.
Okay.
From accidents, trauma, things like that. So yeah, absolutely.
Damn.
That's
So
crazy.
so what other areas, like taking sports out of it? You know, is there any other patients that you've seen with CTE and they wasn't sports related?
Not often. Aside from the injuries from like car accidents, high impact sports, and you know some of the sex injuries that we've seen.
The sex
you know.
injuries.
Yeah.
Oh man.
Yeah, those are the main categories that we're seeing.
I think you were getting ready to get into some of the characteristics or traits or signs of it. I think.
Yeah.
somebody
So I
cut
might
you
have that
off.
shit.
It's possible.
It's possible.
What are
Because
some?
we see
I think all of the men in Atlanta have it.
All of the men?
A loss of memory, you know, judgment is off.
Okay,
wow.
impaired judgment.
But isn't like
She said all of the
suicide and
men.
homicide and all of that stuff related to it as well?
It's not related to that.
Oh wow.
Up on my show.
Yeah. So
Because I've seen. Well, at least that's what they alluded to. Have you seen the film Concussion?
I have. Yes.
Okay, so it seemed like that's where they were going with it. And in the case where I forgot his name, but he just what is the Spanish dude that went to jail?
Andre.
And killed himself in jail.
Andrew Hernandez.
Thank you.
She done caught him 3 wrong names.
Andrew Hernandez.
Thank y'all.
Oh, that's right, Aaron Hernandez. Yeah.
You know what happened with him. So
Well, I mean, there's a
is that
difference
something?
between like movies, right, and reality. You know.
Well, that was a
No, this was a real. It was
situation.
his
Hernandez. He was a
He
football.
played football
yeah,
for the Patriots.
And the Patriots. Thank you.
New
Yeah.
England.
But
He
that, I
had
mean,
a-
it was up north. So
She
if
probably
you
don't
had
know that
Grady,
nigga.
yeah, she probably.
Yeah.
Yeah, you might not know that story. So, what are some other outside of CTE, like other neurological disorders or things like that you are familiar with?
Sure, seizures, you know, epilepsy, obviously. I think the most important thing is that you want to make sure that you're taking care of your body, right? And doing what you can do to try to prevent some of the common symptoms that you'll see. So you want to make sure that you're sleeping, getting enough rest. That's very important, especially for the Black community, right? You want to make sure that you are getting enough rest, that you are eating the right foods, the healthy foods. Smoking weed, you know, that is also a good.
Oh.
She got a little excited there.
Okay.
That's a good way
Okay.
for medicinal purposes, you know, to
So you encourage it.
I do encourage it. As a matter of fact,
So-
what
Oh, you want to hop in the rotation?
I mean,
Is that
Okay.
Zaza?
Hey,
Uh-oh.
it's Zaza.
Yeah. It's just like, what is it?
Uh-oh.
What is
that
it?
the Zaza? What I mean,
I'm
like Dr.
glad
OConnor.
that you mentioned seizures because that was actually one of the things that I did want to touch on with you. Because I feel like it's one of those things that it's not really a lot of information about. And I've had like a personal experience with it that was really traumatic for me to witness. And so what are some things that you can, like, what's some insight that you have on it? Because I felt like I started doing a lot of research, and I know like epilepsy is really common with a lot of people that I really didn't realize how many people battle with epilepsy or how many children are on medication to prevent seizures and what the effects of those medications are and all these different things, and how it's like, you know, like speaking with another doctor, she really didn't have a lot of reason. You're like, so why do children have seizures, or why would someone have a seizure? And outside of like a fever or something like that, it's just like it just happens. Or like your body is like a computer and it just needs a reboot, so they have a seizure or something like that.
yeah, and I mean that's literally what it is. Essentially, there's like a misfire in your brain, which causes your body to react to that. So there's still a lot of research and studies that are going on to try to figure out the cause of seizures and how to make it preventative. But at this time, there just isn't enough research to support it. But essentially, it's like your brain is a computer. Your body functions based on your brain, and it is essentially just a reset that happens, unfortunately.
Quick question, because I don't know what epilepsy is. What is that?
Sure. Epilepsy is, so the symptom of epilepsy, is a seizure. So essentially there is a misfire that's happening within your brain, and your body is reacting to that. Usually you're going to see that manifest in your staring, like you can just be in a daze essentially. You know, I'm sure we've all seen someone fall out, or we've seen it on a movie, where someone falls out and their body is convulsing. There is no control that they have over their body. They've lost control. So those are some of the symptoms that you'll most commonly see.
What is as a person on the other side witnessing that? What is
the best thing?
Yeah, what is the best thing to do?
Yeah, so the best thing, you don't want to stop anyone from having a seizure when their body is reacting in that manner. The most important thing is you want to make sure that they have a clear kind of pathway through their mouth.
Okay.
So whatever you could do,
choke yourself,
exactly, right? Yeah. And if you slightly elevate their head, that will also help with just kind of making sure that
so the best thing to do is just watch.
And that sounds bad, right? just be a bystander.
Nayo, you just watch, bro. You watch. Don't do the wrong thing, bro. You just watch.
It sounds like you might be good at
because in the past they would tell you put something in their mouth so that they don't choke on their tongue.
They
or
lied.
Try to do this, but when it's happening.
So
that does not really come into play.
So look, shifting back to CTE just a little bit, and we were talking about the youth sports,
CTE.
right? No. So we was talking about the
y'all
youth
care
sports.
about these youth, don't y'all? Lord.
Yeah, we care about it. Yeah. So with the youth sports though, what are some of the signs? You know what I'm saying? You see it on the field, you see them running. Kid get smacked, he can't get up. You know what I'm saying? Like, what are some of the signs over a period of time that you think people need to look out for to assume that it could possibly be CTE?
Yeah, so it's difficult in children, right? Because some of the symptoms that you're going to see manifest for CTE, like impaired judgment, right? And as youth, you don't really have it all together. You know what I'm saying? Like you ain't got no common sense. You lack knowledge. You know,
they don't have no common sense.
At all. Name me one that has common.
My boys got common sense.
Oh, well, bring them on in here so I can talk to them and see. I need proof. I need evidence.
You got kids, Doc? You got some
children? I do not, and nor do I want them.
I was about to say that.
You married?
You trying to get married?
Let me find out.
I'm saying
a little connection.
Don't ask questions. Don't ask questions you don't want the answer to.
Normalize dating these rich women out here.
How long does it take to be a neuro?
Well, my story
is she choosing?
Don't hate. Do not hate. Please let her finish.
I'm sensing some cock blocking going on in here. Some cock blocking going on in here.
I care about is the kids. My nigga, the kids. That's it.
Listen, I'll make it known. Yeah. So what you doing after this?
Shoot that shiz out. Shoots that shiz out.
We gonna holler at you as soon as we get off air.
Don't be shy. You can holler at me now.
Okay. Don't be scared now, y'all. Don't be scared.
You sound real.
Don't get nervous.
I'm just saying. I know that I'm intimidated.
I know she's black, beautiful, and educated, but don't get nervous.
I can't say beautiful because she ain't took the mask down. But
well, you know, she doesn't want to get medical attention.
Based off your salary alone,
she gonna take it down.
Based off of your salary, you have a shot at it.
Oh, so you're a gold digger.
Regardless of what that shit comes
out. So you're a gold digger.
He is a gold digger.
Period.
I got my own set.
Not a gold digger.
Somebody who going, you know what I'm saying?
Okay. Oh, you want somebody equally yoked?
Yeah, equally yoked.
But what if she's overly yoked?
That part. That part.
What about that?
I'm sorry, Doc.
Let me get above you.
Social distance, you know?
Hey, man.
All right.
Hey, this some Ratchet Wizdom for real.
Oh, man. We got the right doc in the building today.
He knew what
Look, y'all, it's so funny because when she walked in, she was, hi, how you doing?
Hey.
Right. She came with it, right?
Hi, how are you? Then walked in, she said,
Handshakes only. Where's the sanitizer?
Hey, but that's what's up.
Yeah, but no, that's a great question. To answer.
Damn, I forgot what I asked.
You asked how long did it take me?
Yeah. How long it took?
So I definitely took an unconventional route. It's funny to talk about because after like several attempts to try to get into Emory's School of Medicine, I was denied. So I had to tap into my network, really, and just make it work. So I started plugging into my connections, and essentially my mom helped me get the job that I'm in. And
Mommy?
I am proud to say,
Shout out to mom.
you know,
Shout out to the big Dr. O'Connor.
Shout out to mom.
Okay.
You know, so I went through just 3 years of schooling.
3 years.
So
And you can
bachelor's and
You
then
can-
3 years of med school, you're saying?
Dang, I don't
Wow,
mean
just 3 years in general. Wow. Okay.
Everything is
just give me that
politics.
finesse later. Give me
I
that
will
finesse
give you
later.
the finesse later. You know,
Wow.
everything is possible. And think about this, like
Period.
I am the only black female neurologist at Grady. So they needed me as
Run
much
that
as I
bag up,
needed them. So it really
And
just,
so
you know,
you come
So it
from
ain't
a
too late for
family
them.
of medicine?
it's not too late for them. I do.
Okay.
I do. Yep. Very
I
much
just wanna
plugged
shift
in.
gears right now.
Very
right?
much plugged in, very much connected.
Listen,
Hey man, y'all better know
I'm gonna
people
keep
out
in
here,
contact
man.
with you.
I mean, and if you gotta sleep with somebody to, you know,
Have you got to do what?
Oh, she said you might have to
I said
spread
what I
eagle to get
said.
what you need to get.
I
Sleep
said
your way
what
to the
I
top. That's what she said. That's Ratchet
You
Wizdom.
didn't just say that.
That's Ratchet Wizdom.
She did. She said if you
That's Ratchet
gotta
Wizdom for sure.
She said you got to do what you got to do.
you have to do what
can
you
get
have
the
to
perks
do.
or not? No,
Can I get the
Right. Because it
I'm
sounds
just talking
like
shit. We ain't gonna do that, but yeah, I'll holler at you off
yeah. No,
I mean, just utilize your network. I'll leave it at that.
Yeah, man, we want her to stay at Grady, right?
Exactly.
You know
We
what
ain't
I'm
trying
saying?
to get her canceled.
I don't
Yeah.
want to be canceled.
All right, y'all. Any more questions for the doc? Goddamn, doc.
Oh, you like what you see? You like what you see?
That's what he said.
Just saying, doc
God.
don't give a fuck. Doc gonna hit the
Hey,
I said earlier.
She said that it's good
So-
for you.
Correct.
so you ain't worried
You
about
missed
your Grady colleagues?
I mean, where is this going to be?
Oh, we everywhere.
Oh,
we done.
It's on the internet.
Nah, I'm good. I'm good.
we'll blurry that moment.
Yeah, yeah, we'll
Listen,
blur
if
that.
I get fired, then I need a permanent spot on the show.
Oh, yeah.
Oh, word. You got that.
Yeah, and then you can holler at your mama too. I'm pretty sure she got more.
Correct.
Yeah, she can get you another
more
one.
connection.
Or you could just pop that pussy and get you another gig after that.
For a real one.
This salary only a little bit lower.
Right. Just a little bit.
want to stay in neurology.
It's a little bit lower. You should be moving up.
Were you always interested in taking this career path, or is this just what you stumbled across? Or
It was very much a stumble across situation. I wanted to be a fashion designer, to be honest. You know, I wanted
on your
to be-
brains.
Yeah.
she on your brain thinking
Thinking
about
about
the runway.
I mean, but I'm
The
very
Louis Fall collection.
You probably transitioning out.
Doing a whole
building
surgery.
a portfolio right now.
but yeah, no, I wanted to be a fashion designer, and I wanted to create urban clothing. Like that's what I wanted to do, to be able to reach my community.
So is surgery hard? Can anybody do that shit?
I mean, if I wanted to be a fashion designer and now I am a neurologist,
It's just.
I mean, not to downplay it, but I'm
Yeah,
just saying,
whatever
like,
you
it
put
was
you-
easier.
anybody
just gotta
It
apply
was easier
yourself.
for me, I would say. You know, yeah, I definitely, exactly, apply yourself.
apply
Whatever
yourself.
you put your mind to, you could definitely do it, and that is Ratchet Wizdom.
Absolutely.
Listen,
That's
Correct.
what's up. Well, we're glad you came in today.
Absolutely.
Spending a little time with us.
thank y'all so much for having me, and I do apologize for anything that I said that rubbed anybody's
No, this Ratchet Wizdom.
This ain't the show.
This unfiltered.
No
This
hard
unfiltered.
feelings
This unfiltered.
ever.
Maybe I'll love the kids eventually. We'll see.
Yeah, you just ain't got with that real one that make you be like, oh, baby, let me have your
Put one in me.
Well, she already said she gonna holler at yo after the show, so you know.
Maybe.
Yeah, Dr. Smash.
Spread your seed.
Yeah.
Dr.
Yeah.
Trying
Smash.
to work on my
Dr.
network.
Smash.
Okay.
Networking.
I think I got a couple of slots open in my network, so
Oh.
make some shake.
Looking
All right,
at
yeah,
you.
man. Let's wrap this up, man.
Thank you for
Doctor,
coming
baby.
on.
Yes.
So look, while we
Where
wrapping.
can? Oh, go ahead.
Go ahead.
No, I was just gonna say
Plug her.
Yep, I was gonna say plug yourself if you would like our following to be able to reach you.
I don't do social media.
Okay.
Honestly, yeah, I try to keep my life pretty private. So I
Except
do
for
not.
today.
Yeah, except for today. This is an exception.
Well,
but
you can
I
find
do.
her at Grady.
Nah, if you go to Grady,
Hopefully you don't.
Yeah.
Find me where the money resides. Okay, get yourself a good intern. injury, and come on in and see Dr. O'Connor for sure. Find me with the money.
Get your ass hurt.
That's how you find me.
Wow. Or here.
She'll be here soon. Permanently.
Right. All right, Ratchet Wizdom, we out.
Yeah. Nah, I was gonna close it on the real though.
Oh God.
Let him get it out, man. Let him get it out, man.
We do appreciate Dr. O'Connor. Her name is Tia O'Connor. You two have just been pranked on your own show. Shout out to Dr. O'Connor. Yeah.
She just repeated everything I said about epilepsy. But okay, I'm like, sure.
Yeah.
Oh my fucking goodness.
Hey,
I couldn't wait for this to be over and be like, yo, what the fuck kind of doctor is this?
Hey, nah. Hey.
She said, fuck them kids.
Y'all gotta zoom in on my
What did they say? She better lose.
Oh my
She better do her job.
Y'all are good. Great content.
You should have seen y'all faces, man.
I'm up here being all fucking serious and shit.
Oh my God.
She ain't no fucking doctor.
She not real. She not real. She not real.
Oh, nah, because I was talking about her hitting that weed.
Oh, man.
But that was a good one.
That was a great one.
Hey, you did the thing.
Wizdom. Fucked up.
I really need to.
Hey, now we can say.
Yeah, we can wrap it up, though, man. Ratchet
Wizdom, we out.
Fucking with y'all.
Wow.
Hey.